Melanie Palm.
Happy Friday.
one of our Art of Skin besties. We've got Rickie Hoppe with us. We're doing another Lunch and Learn.
Yes.
We did a little afternoon tea with Christy yesterday,
Yeah,
so we thought we would do a little lunch brief. We'll try and keep it 10 minutes or so.
Perfect.
Talk about chemical peels.
Yes.
I think we got lots of questions about chemical peels and what's their place.
Mm-hmm.
We tend to be a little more device heavy here.
Yes.
But we do offer a couple of really nice light superficial peels, and we're actually going to talk about a couple of medium depth peels, but with limited downtime. So why don't you give an introduction? We carry a couple of VI peels.
Yeah, we do.
And what are the two that we carry?
Yeah. So obviously, like Dr. Palm said, the VI peel is one of the top mid-depth peels out there, and mid-depth meaning it actually penetrates through the epidermis and gets to a cellular level where we want to get that collagen stimulation, and these peels do have downtime. So we'll talk a little bit more about that. But so here we have the advanced. So we have two options. So the advanced is more for fine lines, wrinkles, stimulating collagen, kind of more targeted toward that. So that's the percentages that we want for more aging skin per se.
Yeah.
And then also we have the Precision Plus. So the Precision Plus is more for hyperpigmentation, melasma. It actually has added hydroquinone and kojic acid in it. So you have those two added ingredients that help target discoloration. So if that's your main concern, you'd lean towards this one.
And so, I think we've done it before where I've actually been on camera and we've done one. And you asked, it's about time for me to do one, but I'm actually getting injectables done tomorrow, so I thought probably not the best idea to be getting my skin cleaned after that. I would not allow a patient to do it, so I'm going to follow my own advice. But I think what's cool about this, so it is a medium depth peel, which means we get down into the dermis, the second layer of the skin. And there are several key ingredients. We'll kind of go over those. You distinguish what sort of helps with pigmentation and what differentiates a little bit of the Precision Plus from the advanced. But what is interesting is when we do most medium depth peels, so if we're doing trichloroacetic and we're doing other sort of high percentage glycolics can technically start to get into sort of mid-dermal, they usually are quite uncomfortable.
Yes.
Like I remember when I was in residency, I had a TCA, didn't really have any sort of anesthesia with it. I mean, it felt like spicy. I was on fire, and you can reference that because your husband is a firefighter for 10 minutes, running around the room like, when is this going to stop? Yeah. So it really makes some of the sensory nerves angry. What I think is super cool about this is we get the benefits of doing a medium depth peel. It is technically a medium depth peel with pretty limited downtime, which we'll describe, but no discomfort. So there is an ingredient in this called phenol, and that's typically at higher percentages a deep depth peel, but the actual molecule of phenol itself, which it smells a little sweet, so that's how you can tell it's in the formulation, it acts as an anesthetic, so you don't feel it. So you have the advantage of having trichloroacetic acid, which is typically a medium depth chemical peel ingredient. You have phenol in it, which can be a medium depth to deep peeling ingredient. Combined with some of the other things like retinoic acid, salicylic acid, which is a beta hydroxy acid, and then like you were mentioning, kojic acid and hydroquinone, and then there's some ascorbic acid or vitamin C.
Exactly.
So maybe we can go through, tell me what the peel process is like if people haven't had one.
Yeah, definitely. So with the VI peel, it's really nice. It's about a 30 to 45 minute treatment. So obviously we'll do pre-photos. We'll get have you cleanse your skin, do some pre-photos before we start the treatment. And then it's actually quite easy. So we prep the skin. We usually do an alcohol or acetone prep just to kind of degrease your skin, getting excess oils, sunscreen, kind of a clean slate, I like to say, before we apply the peel.
Degrease.
Yes.
So it's really, degreasing is really important with chemical peels because when we're doing technologies, we can set parameters so we know the energy level, we know the concentration, we know kind of as a result of that the depth and how much surface area we're going to cover with the treatment. With chemical peels, you want to really have that even surface, but if you have oil on the skin and we haven't degreased with something like acetone or an alcohol component, you can get uneven application of these chemical peeling agents, and you don't want that because that can yield uneven results.
Exactly.
Or worse, if an area gets concentrated with something, you can have delayed healing and, you know, I mean, not really with this peel, but with other ones, you know, if you're really not being careful, I think problems with wound healing and ultimately what the skin looks like. So, that's such a critical portion is actual pre-treatment and prepping of the skin.
Yeah, and we'll explain when we're going through that. It's funny because, like, I've been doing this for how many years, you know, people actually say the degreasing kind of feels the most intense versus the peel.
I agree. I think
you have the phenol.
None of this is tough for me, but the degreasing, because we're rubbing a little bit, and the smell.
Exactly, the smell.
The alcohol.
Yeah, we give you a fan, so that helps. So anyway, so we degrease the skin, like Dr. Palm said, and then we apply the peel. So we have a vial, obviously depending on what, you know, evaluation and what your skin can tolerate. Typically we do the whole vial, and that's usually 3 to 4 passes. So like I said, you're finished with the treatment process within 30 minutes. Post-care takes about 10 minutes to go over, and these kits are so nice. I mean, they're beautifully made. In the kit, you get a little aftercare kit. So that comes with a post-kit cleanser, a post-peel moisturizer, has a little hydrocortisone in it to help calm the skin, and then some pads as well. So the pads are actually what helps it be that medium depth peel. So those pads you're going to use the day of and the next day, and those have retinoic acid and vitamin C as well. And with the Precision Plus, it has the hydroquinone and the kojic, so you're getting that lightening. So that's what makes it unique, is you're here and we do the treatment, but you go home, you're continuing for at least 24 to 48 hours after.
And I think when we're here in the office, it's really nice, and we can get a little bit nerdy here, I think, and talk about level of frosting. So that's something we talk about with chemical peels. There's a level 1, 2, or 3. Level 1 just means there's pinkness, or what we term erythema on the skin. Number 2, level 2 is we start to see a little bit of frost, so a little bit of whiteness in the area. And a level 3 is like you don't even see the pinkness of the skin, you are like white alabaster. So that's not what we're doing. We are doing a level 1 to kind of a level 2. So, like, I know, you know, when I've had it done, I think because I'm on retinoids, I keep up with some technology. I kind of get like a level 1. I don't get a ton of frosting. I get maybe a little bit, but not a ton. You know, patients that maybe this is sort of their first foray into things, they have heavy photo damage, you might see more that level 2 when you're actually treating it. Has that kind of been your experience?
Oh, absolutely. And especially too, like personally myself, I have melasma on the forehead, so if I get treated or even do it on myself, I will focus a little bit more on that area, and then I'll get a little bit more frosting in that area. So I of course, like, you exfoliate a lot, so you're not going to see it as much on me. But it depends. Again, are you a retin-A user? Are you exfoliating? Have your cells just turned over, like the stage of where your cells are at? And then, of course, you know, how we're applying it too. So everyone is different, but I would say it pretty much stays from like a 1 to 2. Like, we're not getting full frosting all of them.
And I think it's sort of personal choice. I don't personally stop retinoids topically before getting this done, because retinoids help with skin turnover. They help skin turnover faster, about 3 times faster than what is typically normal. So there is evidence to suggest that if somebody is on a retinoid as pre-treatment, before lasers and before chemical peels, they probably are going to heal a little faster as a result. And so I'm not a huge believer. I mean, you probably, you know, if somebody's getting waxing, we definitely want to stop things like retinoids about 10 days beforehand. But with something like this, I think it's a nice pre-treatment, and I don't necessarily think you have to. If you feel more comfortable with that, you certainly can stop 7 to 10 days beforehand, but I don't think that's an absolute. And what's cool about this is if we had done this on camera, it tingles, it doesn't hurt. It's more the sweet smell of the phenol component that I smell while we're doing it, but we've got a nice fan that whisks that away, and I just don't even really smell it. But you look normal the next day, and it's really, I tell patients like day 3 through 5 that you tend to peel the most. And I think the thing we get asked with like IPLs, with certain laser treatments, and peels is like, do you have to have this dramatic downtime to have results in the skin? And the answer is no.
I know,
You don't even have to peel dramatically. So I think it's really important to level set and set the expectation with patients that everybody's a little different, and just because you aren't getting super crusty and aren't peeling a ton, I actually try and do some things. I think the retinoid that I use beforehand, I don't peel as much.
Right.
And then there's a couple of things that we have patients use, the CMT procedure cream afterwards, and something called Secura Silk that I think we can manage some of the peeling.
Absolutely.
So that we limit your downtime. Because, I mean, I do this at night on a weekday. I'm seeing patients afterwards. I don't want to look like I'm a peeling onion. So, I'm happy to have you guys ask, and it's always like a good conversational note if I'm peeling a little bit. But I also don't want to look like a Frankenstein, Halloween costume that's like a few weeks too late.
Exactly.
So, what do you tell patients in terms of expectations, downtime?
I love that you brought that up, because I always am very clear, because everyone's going to peel differently. Some people, I've had patients over the years, just get light flaking in the skin, and some people actually do get more of the sheets of the skin. And again, it depends on what you're using prior, your skin, what your skin needs. So I typically say we apply the peel on a Monday. Usually within 24 to 48 hours, you're going to start peeling. Usually it's more on the 48-hour end, and typically it starts around the mouth, because obviously that's where we have most of our movement. So you'll get that flaking kind of sheets of skin around the mouth, and then throughout the next 3 to 4 days, it expands throughout the face. So by day 7, your skin is good. You're glowing. I mean, maybe a little excess around there, but very minimal downtime. If anything, the week of downtime, when I say that, it means usually, we don't want excess sun exposure. So if you're going to go walk your dog or something, try not to do it midday. And if you are, wear a big hat and sunscreen. I also don't like any heavy exercise the 2 days after. With sweating on the face, that could cause blisters.
Irritant.
Yeah, irritant. Yeah, so that's something I avoid. It's hard for most of us because we like to work out, but it's 2 days. After that, I just say keep your exercise light. And your regimen is really easy. So for that week, basically what I'm giving you here, plus, the products that we suggest is what you're using. So we're not using...
Yeah, it's very straightforward.
Very straightforward.
There's even an app you can load onto
Yes,
your smart device.
Well. Yeah.
And it will literally, you can take photos every day if you want to. You can become famous and upload the photos to them if you want to. You don't have to do that, but it also gives you reminders of what you're doing every
and that's
day.
Helpful.
Yeah.
Because sometimes, too, there is a couple pads you use after. I'll either write it in your instructions, or you can get the app, and literally it'll give you a little alarm when you're supposed to use the pads.
Yeah, and so the 2 things we tend to add on is CMT cream. It's a product from Revision. It's come out in just the past year, and we use it on everything. The CMT stands for chemical peels. The M is for mechanical disruption, things that we're doing such as microneedling. And then the T is thermal, so that really refers to light and laser technology or things that are heat devices. So anything that causes disruption to the skin, causes pinkness, causes a little bit of inflammation, which all of these things do in a very controlled manner that are powerful and good for the skin. If we can just help with your recovery, we do that. So we love applying CMT cream, having you do that at home at least twice a week, or twice a day, I should say, for that week while you're recovering. And it comes in a smaller container. It's very cost affordable. We're doing a holiday special now. Things are 20% off that are non-prescription strength. And I think that really helped me the last time I did a VI peel, which has been about 3 months. So I'm kind of due for doing another one. And then we got a gommage, which is called Secure Silk. And that is just nice gel. It's not a particulate exfoliant. We want to be careful with the skin. And after cleansing your skin, you're going to use that on damp skin to just sort of rub over it, and it just pills up the dead keratin and it gently lifts it away. And I think that really helped me with the peeling component, so I didn't feel like I was just, flaking to abandon.
Or having, I know a lot of people struggle with literally a piece of skin just, hanging there. And so that will help if you kind of manipulate that a little bit. That'll help release that, because obviously we have to go back to our lives, people try to coordinate it with their schedules, but it is such mild peeling that something like that can help, and using the right products after is very important. That's just like a laser, just like anything, you want to maintain, you don't want to go get exposed to the sun,
And is this a single one and done? Like sometimes people be like, I just wanted, there's recency bias, and I think sometimes we don't examine our skin until after we've had something done, and then we are just examining it. So, we here at Art of Skin MD, before we touch any patient, we take photos, we go over baselines, but this is something that's not a singular event. You need to do it as a series of treatments to have the benefit. So I think if you're going to choose to do it, you need to commit to doing, usually 3 treatments. And then after that, go into maintenance phase. This is like, just like you wouldn't stop your gym routine if you're trying to reach sort of exercise or fitness goals. You don't just do a series of 3 of them and your skin is forever blessed.
Exactly.
So
exactly. Pretty much like everything we do
maintenance
here, maintenance is key.
Yeah.
Absolutely.
Yeah, and we can give you, skincare recommendations right now for the month. We're starting to run our holiday special, which is 20% off non-prescription strength skincare line. So if there are supportive products we want you to use with this to help get you back, or maintenance things once we've got you in a good place after the series of chemical peels, super important.
Yes.
And then you wanted to mention that we're going to be doing a special
yes.
VI peels.
So next month, keep your eyes out. We're going to be doing a monthly special for the month of December. And that'll go on all month. Obviously, if you want to get ready for, Christmas or Christmas parties or whatever you're going to celebrate that month, we do suggest it to do the peel earlier in the month, because with the week of downtime, you want to make sure you're just prepared to have that to be ready for holiday parties or whatever you choose to do that month. Or you can simply save it and we can, you can pre-purchase and we can do it later, in the year.
New year, new you.
New year, new you.
New face.
Exactly. New face. All of the above.
So we've kind of covered VI peels. We carry the 2. One, the advanced, more for sun damage, photo damage, textural, so skin aging.
Yeah.
The other one targeted a little bit more at precision of pigmentation, which is precision class, melasma, just overall sunspots. Key ingredients in these is, if you want to go over it, phenol, the retinoic acid, which is really important in some of the peeling products, trichloroacetic acid, which is the TCA, salicylic acid, which is a beta hydroxy acid, and then depending on the formulation, you may have kojic acid and the hydroquinone to help with brightening agents and vitamin C as well. So really novel combo, and I think it's lovely that we can have such powerful ingredients with pretty minimal downtime and very minimal discomfort, I think, while you're having it.
Yeah, application is bad. People think chemical peel, or they think of Sex
yes.
The bright red. I don't know if that was a laser.
Samantha and her covered veil. Yes.
Exactly. So, obviously you may be a little pink after, but it is not a process like you see in movies or shows sometimes.
There are things that we do here that can bring that appearance, but that's a much longer conversation and dealing with other things. So I think if you want a little boost and you want to get on a consistent sort of regimen, maybe you want to skin cycle a little bit and add chemical peels into your skincare regimen, this is certainly, I think, a nice way of having some of the options with really great active ingredients to help boost the skin and support it. So I want to thank you, Rickie, for this. If you guys have questions, Rickie is such a source of knowledge. She's been doing skincare forever. It is a real just passion, I think, for her. And then obviously if you have body needs, she is just one of our 2 gurus, along with Christy Cashman, on this non-invasive side, where we do muscle toning and fat reduction and skin tightening. So what's nice is sometimes you can be doing something like Sculpt and you can be getting a VI peel at the same time. So let us know if that's something you want to I'm big on multitasking, so I like doing multiple things at once. Right. But if you want to book a complimentary consultation with Rickie Hoppe, she's here on select Fridays. We are open basically 8:30 to 5 if you want to give us a ring. 858-792-7546. We've got a wealth of knowledge on our website, which is artofskinmd.com, and you can certainly contact us through that venue as well.
Yes.
All right.
All
so
right.
Hope everybody has a wonderful Thanksgiving. I'm going to do the old-fashioned way. I'm going to click us off, but thank you guys for tuning in, and we'll post it as well.
Yep.